We are now going to talk about nutrition and swallowing. So I'd like to invite our panelists to join me up here on stage. We have 4 fabulous perspectives on this panel this afternoon. So closest to me here is Katie. Katie is a registered dietitian. Many of you probably know Katie because she provides fantastic services for our head and neck cancer team. Next to Katie is that Amy or Jennifer? It's Amy. Amy is going to provide the patient perspective. And then next to Amy is Jennifer Kizner. Jennifer is one of our speech pathologists who's going to talk about the swallowing end of things. And then on the end is Evie, who's going to provide our caregiver perspective. And so I think what we'll do is I'm going to start with you, Amy, if that's okay, since you've got some pictures.
Hi, I'm Amy Fothergill. I am 5 years out from when my this whole process started. And I found this picture because I thought it was important. It's what I call my PC picture before cancer. Literally about 2 days before a series of events started that changed my life. But I'm still here, so it's okay. My background is I went to culinary school. I was in tech for a while. It was a very interesting transition. We can talk later about it. And then once my kids were born, I got back into food. So I called my business The Family Chef because I wanted to teach families about healthy eating and how to get your kids to eat veggies, etc. And I love food. I love eating. And there's a reason I'm telling you all this. So when this all happened, I decided I needed to really practice what I preached. And my big mantras were going in strong and having a good attitude. And I just kept moving until I couldn't, which I've mostly been able to move. So today I'm going to talk about my cancer journey, how I was balancing nutrition with all this, and my swallowing challenges. And just real quick, how many patients are in the room? I'm just like almost, okay, so almost half. Okay, next slide, please. So this is how it all started. So I was on vacation with my family. My husband and I went for a walk, and I'm Italian, and I'm always like, you gotta like this. And I was talking, and we were walking, and I was eating some bread. And all of a sudden, a piece of the bread got lodged in my throat, and I started coughing, and I coughed it up. But for about an hour, I felt like, gosh, that feels like that bread is still stuck in my throat. And then it was like even an hour later. And then it finally started to get a little better. And then maybe 3 or 4 days later, my husband said to me, he goes, your breath really smells, and it never smells. And I'm like, well, that's really odd. So what do? I'm like, well, let me Google. What could it be? And I'm like, oh, it's probably acid reflux. And one of the things that cause acid reflux, coffee, chocolate, wine. And we were in Spain. So I'm like, oh, this all makes sense. It's just that when I get home, we'll go to the doctor if it's still a problem. So about 4 days after that, we leave. We're heading from Barcelona to New Jersey, not where I live, but just where we were landing. And about 20 minutes into the flight, my mouth starts draining blood. I'm like, I thought it was saliva. And I'm like, oh my goodness, that's blood. And I had to call the button with the flight attendant come over. I'm like, could you see if there's a doctor? I'm not really sure what's going on. And it stopped, luckily. And then the doctor came over. She talked to me. She says, actually, when it's bright red, it's okay. It's, there's probably something just draining. I told her about the coughing incident. So I thought something just popped again, not worried about it. But it happened so over 24 hours, it happened 3 times. So we got to New Jersey. I talked to my doctor. They said, okay, it doesn't sound like it sounds like you're stable. Come see the gastro when you get back. And again, I'm just like, all right. And I was a little fragile. It was like, didn't want to eat anything, but it started feeling better. So by the time I got back home, late May, I had made the appointment. I go see the gastro, and he's like, well, we'll give you an endoscopy. You need a colonoscopy anyways. Well, we'll do all this stuff. And he said, but you know what? What's really weird is like my throat still hurts, and it hurts right there. It doesn't hurt in the middle. It hurts on this one side. And he's like, so Thursday at 5:00, and he said, go upstairs and see the ENT and just tell him your story and see what he says. So I go up there, and the next picture, which hopefully isn't too graphic, is of my throat. It's not the exact picture, but I'm like, it's a picture of a throat. And of course, he sees the tumor, but he doesn't tell me he sees the tumor. He just says, oh, there's a foreign object. I'm thinking it's a flower or the piece of bread that I inhaled, having no idea. And I had all my testing and all that, and I really started feeling better, and I thought everything was okay. And then he said to me, he goes, we kind of need to do a biopsy. I'm like, really? He goes, well, we might have to get, and he started using C words, chemotherapy. And I'm like, chemotherapy, what? So he did the biopsy. They found it was cancer, and it was really, really scary. And I felt a lot of emotions because I had prided myself on I'm a healthy eater, and I work out, and da-da-da, and I was really shocked. So I have some notes as well. Oh, yeah. So I was scared, shocked, sad, and betrayed. And another thing, I was really overwhelmed because I went to see how many people have been in the chair, and it's like I had 12 people around me, and they're saying all these things like, oh, like surgery, and then we'll do probably radiation, and probably no chemotherapy, and you might lose your, sense of taste. It may be a month, it might be up forever. And when, as a chef, as a cook, as a mom, and someone saying, I might lose my sense of taste forever, which has happened. I know it has happened. I was really upset. There were a lot of tears, but that's what I was faced with. And when I walked out of that room with my husband, I was like, all right, I got to go in strong. I got to just do what I can do. So you can go to the next slide. That was actually the day before my surgery. So during the months of prep, or maybe a month of prep, I just decided I was like, no more alcohol, no more sugar. I was already gluten-free, no more dairy. And this is my story. I'm not saying this is what you should do, but what I'd found was those items were really inflammatory. So I was trying to keep my inflammation down. I figured it couldn't hurt. It's not like I needed those foods. And I exercised, and I just tried to take care of myself up until the surgery. And I remember going into the surgery thinking, oh, it's just like, they're just going to go in, remove a little thing. Because the tumor was at the base of my tongue, so I couldn't feel it. But they saw it. And I was like, oh, no big deal. So I went in with like books I was going to read. I was going to do some color. I was very not prepared. It was probably better. And then I woke up. It was like 8 hours later. And I'm like, oh my God, it's dark out. Like, what's this tube with all these tubes in me? And it was shocking. So I was able to sort of talk. I was, my tongue was sort of attached. And in the hospital, I just made, I had a feeding tube at that point, and I just said, okay, I'm going to, and I couldn't have the dairy and the gluten, so I had to be careful what I was getting on the tray. So I was having Kate Farms, the nutrition. It's like a little smoothie. I had Orgain, fresh juices, and bone broth. I'm going to talk more about bone broth because I feel like it's one of those things that can really help with healing. It's all, it's been going back many years. And again, that's my after picture. As I did actually walk out of the hospital. I had to take the wheelchair, but I was able to walk out, and that was about 5 days later because I was like, I just want to go home, like Dorothy. I just want to be home. So, next slide. So then I got home, and then it was all about the healing. And Julie would be proud of me if I have my, my food log there and what pills I had to take, and I tried to keep track of everything. And I just did everything was slowly but surely. I was, I remember not being able to eat a lot, but I had to feed it to about 3 weeks, and I was putting in anything I could that was nutritious, that, like the broths and the soups and anything that would really go in there. And I was eating really slowly, which I laugh now when I'm looking at, wow, mashed potatoes, scrambled eggs, and spinach. That was, and I think maybe I ate half of it. And it was just slowly, like, just trying to, get in my tongue to push the food back and the soups and such. So at that point, I still had the thing I missed the most, which is saliva. So I was able to eat it. And next slide. And then pre-radiation, so we decided that I needed to get radiation. So we're still in the pre-radiation phase. So I'm starting to slowly, now the feeding tube is out. I'm eating a little bit at a time. And I ate salmon, and I had shrimp that I remember this was my birthday dinner. The mashed potatoes made my husband look crazy. I was like, you can't have any skin on them. It has to be smooth. I think it has to be smooth, but I was eating pureed soups, and I was having pasta and things like that. And then next slide. Anybody know this that stairwell going up to radiation? Yeah, then radiation started. That's how things change. And they said, oh, you might lose your your saliva like, 1 to 2 weeks in. And I remember it was about the third day. And I just woke up and I swear it was just gone. And this is my little friend, my little water bottle that goes with me everywhere. So that was a big change. And I just kept, eating what I could or swallowing what I could, try to make it nutrient dense, try to make it healthy. And I remember I was like, as each week progressed, I was like, okay, I think we'll have pancakes. Like the eggs were getting stuck in my mouth. So I was like, we'll have pancakes with a lot of applesauce and syrup. And then it was, how about just macaroni and cheese? That works too. Right, next slide. So I want to do a shout out to Jillian, who was here earlier from the library, because she, on the left, on your left, there's some books that I had gotten from the library about clean soups and how to, make some healthier meals. And there's a lot of pureed food in the background because that's all I was really able to eat. And as the radiation progressed, it was, I couldn't have anything acidic. I stopped, like, even chocolate things. Everything was bothering me. So I just ate what I could. And then next to that there's a picture of Thanksgiving dinner with a lot of gravy. And I remember specifically that I was like, oh, I can't really taste this. I'm like, it's just tasting, like, if the taste is a 10, this is like a 5 or a 4. And then within a few days, I couldn't taste anything. And I'd say that I tasted, everything tasted like nothing or cardboard. And even though, the picture of me holding the mask, people know about the mask, was, I was smiling, but it was, I didn't really feel that great, but I was just pushing through. And then the other photo, you could say I'd take a lot of pictures of food. No pictures of myself, but I looked at the food. And that was Christmas. That was maybe 3-4 weeks later. And I ate that meal and I remember, oh my gosh, I think I tasted something. And I had this glimmer of hope. And I was like, oh, so that was better. But, people, so through the process, I'd say I had about 7 to 10 really bad days where food was not bringing me any joy at all. It was all about just the calories, and it was a process. It was not fun. And, it was just, I remember, and again, it's like childbirth. I'm like, oh yeah, having a kid, having a kid, no problem. But like, it'll be good in about 3 months, you're going to be like, no problem. But, I look at this now and I'm like, oh, is it really that bad? And I'm like, oh yeah, it was. My brain made me forget what it was like. So but I got through. I got through it all. And people would say, oh, you've lost weight. You look so good. And I just, like, inside, I didn't feel good and I didn't want to go through the whole story. So I'd be like, oh, thank you. But the best comment was someone's like, you look so good. You're just glowing. And I said, thank you. And the bubble over my head said, no, that's just the radiation. I was like, all right, next slide. So throughout my healing, once the radiation was done, it was all with the healing. So again, it was adding calories, smoothies with protein powder, nut butters, avocado. So there was a recipe out there that I had made before, like a chocolate avocado mousse with, again, coconut. And not a lot. I wasn't having a lot of refined sugar. That soup was probably just soft and mushy, and I could just sort of swallow it. And it was one day at a time and just get through. But I remember thinking once the radiation was done, maybe 2 weeks later, I was like, oh, I should start feeling better any day now. How many other people, right after radiation, were like, I'll feel better tomorrow. And it took probably, it was like 1 to 2 years. And that's what they said, but I didn't quite believe them. But I would say it was more like a month. Like, it would be a month and I'd be like, oh, like, I can eat that I couldn't eat before, or I could appreciate that, or that's not bothering my tongue, or not bothering and it's more there. And again, I was staying at anything spicy, forget about it. Acidic, I was getting a little bit better. So there was a lot of gravy. I made a lot of gravy, and I realized that I really had to be in the long game. It wasn't about just feeling better the next day, because I recovered from the surgery pretty quickly, but I was accepting that I just had to be patient, which was hard for me, but I did. All right, last slide. So there I am. That's actually, I think that was in April, believe it or not, but I slowly felt better. I just started slowly eating more and more. I did end up losing about 20 pounds, which I have put back on. I'd say, milestones were in months or 6 months, and then it became years. And I don't know if anyone can agree with, but these are things I never thought we'd eat again. I never thought I'd eat popcorn. I never thought I'd have ice cream because the cold bothered my tongue. Any kind of wine or alcohol. Fresh fruit bothered. It was like I couldn't quite swallow, or it was the juice would I was always coughing when I was having fresh fruit. Sushi was, I almost choked to death on sushi because it got stuck in my throat. And this was like last December. And I'm like, I have to have my water with me no matter what. But and then anything spicy, I just didn't think I'd ever eat those. And then these photos are post 2019. So I can have some wine, even red wine. I can have sushi. I can have ice cream. So the spicy is hard. And we were at the table talking about how you go into either Mexican restaurants or Indian restaurants and you'll say, is it spicy? Oh, no, it's not spicy. And you take a bite and your mouth is on fire. And you're like, oh. So that's sort of my story. And again, I think it's all about having a good attitude. I think going in strong, the nutrient dense whenever you can. And that's what worked for me. And I'm very happy to say, just like Elton John, I'm still standing. That's, yeah.
Thank you, Amy. Evie, do you want to speak next from a caregiver perspective?
Hello. Hello, all. My name is Evie. I care for my husband, Jorge, who was diagnosed with cancer end of 2021. Beginning of 22, he had chemo and radiation. And then about a year and a half later, we found out that the cancer was still there, so he had to have surgery. And we are now at 10 months after surgery. So I was invited to this panel to talk a little bit about food and some ideas of how to help a cancer patient take in nutrition. And I was a little perplexed. Why? Right? Because I was like, I don't know what kind of advice I have for people. I don't particularly feel successful in helping him that way. I guess the idea was that in both the scenarios that he had to deal with, the chemo and the radiation and then the surgery, afterwards, we were able to keep him away from the hospital. We had him enough nourished and hydrated so he didn't have to go back to the hospital. Otherwise, I feel like I faced many challenges as a caregiver. I'm talking about myself here, in finding out what kinds of things work and do not work. And these are two different sets of difficulties. Once you get out of chemo and radiation and once you get out of surgery. So I have some notes here. What happened after he had radiation, not after, during having radiation and chemo, like after he started, like into the 3 weeks and several weeks after he concluded, was that changes happened very quickly. So he started out his chemo and radiation going, with his lunchbox and having his lunch with him, right? And coming back with that lunchbox empty. And then 3 weeks into it, the lunchboxes started coming back full. Okay, so what do we do? And I was like, okay, how about we start blending things? Well, that worked with blended soups and things like that until it didn't, because the the byproduct, the side effects of the chemo and the radiation started piling up, making it more difficult to eat. So I started, scratching my head thinking, okay, we need blending, but we also need something that will get into him the highest amount of calories, but with a minimum effort. So I started coming up with those recipes that I'll be happy to share with you if that's where you are in your recovery or in your therapy. But the idea here is, if you are to keep anything out of this, is like your best friends would be avocados and coconut cream. They are easy to blend in bone broth, right? They're very tasty. These were actually really gourmet soups that I was making for him. And you can create, I was able to create concoctions of like 2 cups, and those 2 cups of the soup were containing 1,000 calories with all the things that I was packing in there. There was a point that he did end up losing, during the radiation and chemo, a significant number of weight. At some point it was 35 pounds, and that happened suddenly. It wasn't like the product of him not eating only. It was, the effects of the chemo and the radiation. So if I kept a lesson from that, is that it's not so much about being successful in getting food down his throat, but getting enough food so we can manage complications, basically. Enough nutrition, enough hydration so he can continue going. That was my lesson. And then after his surgery, things were a little bit surprising, because right now he's at the point where he's 50-50. 50% of his nutrition goes in him through his feeding tube, and 50% of his nutrition goes in through mouth. And the surprises here are that things don't have to be blended anymore. The preferable things are things with texture, like crackers and tempura. So that my list after surgery is a very different list from the chemo radiation one. And other surprising things like meatballs, not our friend right now, but franks are, sausages are, right? The other one is also packed with nutrients, things like boiled root vegetables with olive oil and salt and benign flavors like adobo. That it's not spicy, but it's packed in flavor. Gyro, of course, goes down really well. Here's another one. Caramelized pecans with cheddar cheese. It goes down really well. And in both cases, in both scenarios, I found out nutrition was one thing. 2 other factors were big ones. One is time. Things take different time to go down, right? It can take a really long time or not. We find out at every dinner opportunity, right? And distraction. Distraction is a big one for eating. So we can, at dinner, we just put a movie on. I get up, about half hour after the movie starts, and I take my seat on the couch, and Jorge will still be at the table eating and watching the movie. And by the end of the movie, he had a really good dinner down, so he can go on with his life. in a nutshell, that's what I have to say about nutrition. The other part that I want to share with you is that I brought with me some resources just for us caregivers. I should tell you that by profession, I am a clinical social worker, and I've been a clinical social worker for a long time in the Bay Area. So I basically know everybody or worked for everybody. And there's a wonderful nonprofit organization that is called Family Caregiver Alliance. They are the Bay Area Caregiver Resource Center, and they offer wonderful support services just for us, the caregivers, the family members that find themselves in positions that they're not necessarily, their original role, but now they are caregivers. What is of particular interest to us as caregivers is right now, I know their clinical supervisor, which is a very good friend of mine, and we were having dinner the other day, and she was telling me, Evie, right now we are sitting on a pot of money that we need to spend by the end of the fiscal year. And these are respite grants. Tell all the caregivers that you know that we have respite money. This is actual dollars that can be given to families as grants to hire a caregiver. And this is particularly relevant to us that if we are to need hired caregivers, we need them for a short period of time, because what we're dealing with is it has a time frame of its own. It's not like cognitive disorders like Alzheimer's that will go on and on and on. So I brought brochures. Of course, I left them at my table, but I'll be happy to make them available to you. And then the last reason why I came to this symposium and be part of this panel is that I wanted to connect. It's time for me that I do. For the last, 2.5 years, it's been a lot of work, and it's time for me to also connect, join. So I'm really happy to be here amongst all of you. Thank you for your time.
Thank you so much, Evie. Katie, you want to hit on some of your top tips from a nutrition perspective?
Absolutely. I wanted to thank both of you for sharing, because I know it's hard to share those things, but I also think it's so helpful for, I'm sure Jennifer would say the same too, for us to hear as well, right? We know these things, we hear these things, but to hear it from your perspective can be really eye-opening for us. So thank you for sharing. You both actually hit on a lot of the tips that I have already. So, I mean, your dietitian's at heart right there. So what I wanted to say is chemo and radiation definitely can have some nutrition side effects that can make eating much more difficult, as both Amy and Evie have shared here. So chemotherapy, just depending on the agent that's used, nausea, vomiting, sometimes taste changes, mouth sores, can make eating much more challenging. You couple that with radiation or just radiation alone. Radiation has its own set of side effects. Similar side effects, taste changes and mouth sores can occur, as well as dry mouth, thicker saliva. So all of these things just make it really challenging. Not only the physical function of swallow, but your appetite too, right? I mean, none of these things are going to make you want to reach for food. So like both Amy and Evie have said, really focusing on your nutrition as best we can to optimize before treatment if we have the luxury of time before. Sometimes treatment can start pretty quickly, but the more that you can optimize how well you're eating before, as well as during treatment, just so you feel your strongest. It's hard to say you feel your best because I know that we're throwing a lot at you, but feel the strongest that you can through treatment. So for nutrition, again, it's focusing on the most nutrient-dense things. Obviously, avocados are always on my list as well, as nut butters too. Coconut cream is also in my toolkit too, so thank you for sharing both of those things. But finding ways to just really maximize how much you're eating And know that we don't have to stick to 3 meals a day. I think that's the first thing that goes out the window. I tell all my patients I should have shirts made that says small, frequent meals. Eating all throughout the day really is the best way to get those calories in. Your nutrition needs are just cranked up. Your body has so much need for nutrition during treatment and after for recovery because your body is doing a lot of healing. So it sounds a little counterintuitive, but while we're getting treatment, our body is doing a lot of work, especially if we're having radiation. The radiation is doing what it's supposed to do. It's targeting our cancer cells, but some of those healthy cells get damaged along the way. So what we want to do the best that we can is really put the fuel into our body. So trying to maximize our calories, small, frequent meals, and really focusing on good protein foods, each meal, each snack. And then Amy had mentioned Kate Farms or just other liquid drinks can be really, really helpful. Protein powders, just things that we can fortify and supplement the foods that we're already eating. So we can take something that is small volume and really maximize its the nutrition value for it. Fluids are also, of course, very important for both chemo and for radiation. We really want our bodies to function as best that they can. And some chemotherapies, we really want to protect our kidneys too. So we want to make sure we're staying as hydrated as we can and to help moisten those mucous membranes too. The dry mouth definitely is going to be a side effect of radiation, but the more hydrated we can be, the better we're going to feel. So if you're eating, we can, really make sure we're maximizing what we're doing with our meals. If you're on a tube feeding, we also want to make sure we're meeting our nutrition needs for food and for fluids. So whether that's a combination, like Evie was saying, for food and nutrition or tube feeds, or just your tube feed, making sure you're meeting your nutrition needs. So if that's asking the doctor for a referral to see a dietitian or, making sure you're reaching out and having somebody check in and just make sure that formula regimen that you're on is meeting your nutrition needs. But because what we have found is keeping our weight stable through treatment really does have the best outcome. So it keeps us strongest. It helps us recover as quickly as we can. So we really do want to make sure we're getting the fuel our body needs to keep our weight stable through treatment.
Great. Thank you so much. All right, Jennifer, do you want to talk a little bit about swallowing and maybe what you think are some of the key pearls that people need to understand about swallowing?
Sure. First, I want to thank both of you guys for telling your stories because it really does. I think Katie and I are looking at each other like, yes. And then I just want to pause because I don't know when there's time, but I do want to give Heather a big thank you and congratulations for putting on this symposium year after year. It's definitely one of my favorites. So I'm one of the speech pathologists in the head and neck oncology clinic, and I'm really excited that we have 4 full-time speech pathologists within our head and neck clinic, and we are the rehabilitation professionals within this clinic as part of the team. Our goal really is, if we're talking post-treatment, to optimize your function. What functions? Your speech, your swallowing, your voice, depending on where your cancer was and what your treatment was. The biggest concerns, specifically if we're talking about post-radiation, and we've talked a lot about it today, that could affect your efficiency of swallow or your safety of swallow, would be things like dry mouth, change in taste. A big one that we focus on that can, really be long-term, lifetime after treatment is stiffness in the muscles that were in the radiated field. And my radiation oncologist would agree with me that there's a really bad quote that I say to my patients, that radiation is the gift that keeps on giving. So I tell my patients, even if they're 5, 10, plus years out, you have to keep daily active management of moving those muscles because they're not just going to relax on their own after that. For the folks with more tongue cancers or oral cancers, the articulation, the intelligibility, that can affect both social and vocational experiences. So we work on articulation and, again, stretching the muscles, strengthening the muscles if needed. Internal or external lymphedema or the swelling that can happen. You can have fluid that can remain after your treatment. It's called secondary lymphedema, and it's typically after surgery or radiation. And then even more long-term too, cranial neuropathies. So you can sometimes people will get spasms either in their neck, their tongue, and again in the area that was radiated. So I often think when people say, why am I seeing a speech pathologist? Like, I talk fine or I do it. Just think of us as like the physical therapist for the head and neck. I think that's just an easier way for most people to understand. And I'm talking to the choir in this room because I'm hoping that most of you have been working with your speech pathologist or seen a speech pathologist to kind of maintain and optimize your function long term. And if you didn't get a chance already, if you look at there's a table outside in the vendor area, and you kind of see all of our tools and tricks and things that we have out there. And even for those folks who are, after 5-6 years out, we still want you to come in and see us and just making sure that we're optimizing your function and checking to make sure there's not little changes that are going on that we can kind of nip in the bud with our behavioral management that we do.
Thank you, Jen.
Yes.
So speaking of that rehab table, in case anybody has not been there, those of you who've been here before know that in past years we've done a recipe raffle, and we finally made the cookbook with the recipes from the recipe raffle. So we have a new nutritional reference that we put together that's got recipes, but also information like what Katie's speaking about, information like what Jen is speaking about that we give to patients as they start their radiation. So if you want to check out what that final product looks like, you can see it on the rehab table during the break. But we're going to go ahead and open up to questions at this point.
Thank you. So two of you have talked about the benefits of using coconut milk or coconut cream, and I'm certainly willing to use. I use a lot of nut butters and all this stuff that you guys talked about, but I'm a little bit concerned about the saturated fat in that. And I do a lot of pureed stuff, so I'm looking for things to enhance flavor, but I haven't been using the coconut milk cream because of the saturated fat issue. Say about that.
Yeah, I think being mindful of how often you're using it. So I think if you're using it once a week, once or twice a week into your, one of your soups would be fine, or a smoothie, something like that. I probably wouldn't use it multiple times throughout the day, every day, just to be mindful of that. But I would say that about any saturated fat too, right? And then coupling that with other unsaturated or monounsaturated fats. So more of those things like you mentioned, the avocados, or ground flax seeds, nut butters, things like that, using some other things that are healthier fats too. So just a balance of using it.
Can I?
A soup and why that, enhance the flavor of it. How much coconut?
For the shot. So the coconut cream is so dense, you probably only need a tablespoon or so. And please correct me if I'm wrong. Remember, coconut is plant-based, dairy is animal-based. So it might be saturated, but you're not comparing apples to apples. And so it is saturated, but it's a different derivation of saturation, so of fat.
Yeah, but I agree. Just you're going to be using such a small amount. Just being mindful of how frequently you're using it. Good question.
May I? Hey, thank you for asking about coconut cream. Just remember that it's a little bit more benign than heavy cream, right? And the reason why you may want to use it, and the reason why I have been using it, is because as I said, my goal was to pack as much calories as I could into that little concoction that I was creating. And the coconut cream was one of the healthier alternates to heavy cream. Now, specific dietary restrictions or personal likes or dislikes should be taken into consideration in using those tips. So depending on your situation, you will learn to adjust it, right, with the guidance of your dietitian. 1 little tablespoon of coconut cream is 50 calories. So if you're using a couple,
that's 100 calories right there, that it's easy to go down. That's the perspective that I spoke from when I was talking about coconut cream. Makes sense? Yeah, and I just want to add a little tip. You can either buy coconut cream in the can, and it's just the cream. If you buy the canned coconut milk, put it in the fridge, then take it out, and all the cream will solidify. And then you can take that water and use that as your for a smoothie, for a soup, anything. But if you're looking for just the fat, you don't have to buy the individual cans. And then if you want the opposite, where you want something that's creamy but not just the fat, I then take the can and put it in hot water, and I shake it, and it sort of mixes so that it then becomes all of the water and the fat mixes together. So then it becomes more like heavy cream and such. So if I make a whip, because I try not to eat dairy, it makes me congested. So I would take the coconut cream and I use that with a little bit of confectioner's sugar to make a whipped cream. But if I want to make something that's, say, a cream of something soup, I will mix the water and the fat together. So it has to be probably about 80 or 90, 100 degrees to get it to mix together. And if you want the opposite, put it in the fridge.
I'm Jorge. I'm Evie's patient and husband and admirer, biggest fan. So a few weeks into radiation, as you mentioned, my body got hit with a surprise that it started losing weight at an unprecedented rate. What I understand is that the body realized it was being attacked and it was reacting. So the demand of calories and other nutrients was off the roof. So no matter what I could eat, I was just losing weight. And it took us by surprise because it went from losing weight to just tailspin. And at that point, you take whatever you can, regardless of long-term effects or how healthy it might be in the long term. You just need to avoid crashing and the hospital. So stuff like this, you forget about how much sugar or fats or whatever. Just I would say just take it in for the time. Even after a few months after the treatment, I started exercising because I was exercising before. I was riding bicycle twice a week, and I realized that nothing that I would eat would make me fat. It was like I had a blank check. I would buy like 3 Newtons, eat the whole bag, and I wouldn't gain weight. It was fun for a while. But it's just temporary, just for a month.
Yeah, hi there. I had a question about swallowing pills. I do a reasonably good job of swallowing food. I mean, I can kind of control it and the texture and the liquid. I don't really talk much when I eat because I have to really focus on my eating. But pills is another area. So I cut them sometimes so they're small. But it seems like I just have to really, it seems like it's just a dramatic swallow to swallow pills down. And I just don't know if I've heard that before or it makes sense or what to do about it.
Someone gave me the tip once, which seems really opposite of what you should do. But I put a pill in my mouth and I lean forward and then I swallow and it actually goes down as opposed to this. Have you tried that? Leaning forward. I know if you, with some water or something in your mouth and then swallow leaning forward and it actually shoots it down. I don't know if there's any research.
I think whatever works for you, do it. Yeah. Pill swallowing can be challenging for a lot of people, right? And then you add radiation or dryness or into the situation or stiff muscles. I think what I recommend are a couple of things. One, if they're not time-release pills and you can crush them, you can crush them and put them in a shake or an applesauce or something like that. You guys were talking about coconut cream. I like coconut oil. So you can take the pill and just dip it in the coconut oil because it's all about lubrication. There's some people who will take a little bit of coconut oil and lubricate their mouth before. Some people, I know we talked about over-the-counter saliva substitutes like Biotin or Mouth Coat or Oasis, but You can also take coconut oil and put it like on your cheeks and the roof of your mouth and try to help with the lubrication. We also have natural pockets in our throat, 2 at the back of the tongue and 2 at the top of the esophagus. And they're like these little safety nets that if you don't swallow something down the first time, it's not going to go directly into your airway. Why? Because we know, and all of the folks who've gone through the treatment, I'm sure know, your airway sits right in front of your esophagus. So your breathing tube and your feeding tube are right next to each other, and that's where we get concerned, right? So as long as, like, if you feel like a pill is in there and it's stuck, but you can breathe okay, it's probably in one of those safety nets or pockets. So in my mind, I'm trying to say, well, how can we keep the system lubricated so that pills can kind of flow down? So you can have it, drink some sips of water before you take the pill, use the coconut oil, put it in applesauce. I think I could probably ask all of you and you can tell me all the great things you do to get the pills down. But I do like what you said, where when you are swallowing something and it's going to be challenging, no distractions, don't talk to anyone, just focus on getting that, whatever it is, down. Because I think more so people get into issues when they say, oh, I forgot for a moment and I got distracted or I was talking, and that's when I'll cough or choke or something will happen. So I don't know if that's helpful, but
Hello, I have a couple of questions, if that's okay. So the first is, how long is too long to depend on the nutrition shakes? Right now, it's kind of the only thing I can depend on eating, and I know I would rather be having different food, but for just pain reasons, I can't. But yeah, I'm concerned about relying on that.
Without knowing your whole history, it's hard to say. But and again, not knowing what shake you're on, I would say most oral nutrition supplement shakes, that are medical food supplements. So Kate Farms was mentioned, Boost, Ensure, those types of products. I mean, technically, you can be on them. Again, from a swallow perspective, I'm sure the texture, advancing texture is of course important, but nutritionally, you can get what you need from those. Some might have fiber, some might not, so they might not be fully balanced in that aspect, but you'll be getting all the micronutrients, calories, protein, fats that you would need. But it's hard to say with limited information. Yeah.
Got it. Okay. I'll just either away.
No, but again, when you end, I don't know, again, if you have radiation or chemo, but when I was sent to radiation, I was like, oh, I'll start feeling better. I recognized it was really a year or two. My body was still, it was kind of nice, but anyway, I was still losing weight. So I just had to stay on top of it. So I would use the shake as a snack, and I would keep it with me because it didn't have to be refrigerated. It was shelf stable. So if I was somewhere and I was like, oh, I'm hungry and I can't eat, things that are just there, I think that it's fine. I think eventually you'll just want to have, regular food, but it's the further you go out, it'll be easier.
Yeah, right now I'm about 3 months out of radiation, so that's where I'm at. Okay. And then the second was if you have any suggestions for increasing appetite, because right now food it sucks. And so that's why also I depend on the Kate Farms, because it's dependable. It doesn't hurt. I can get it down. But otherwise, I'm not really interested in having food. If you have any suggestions. Or I guess just like putting myself out there to try a new food, if that makes sense.
Yeah, I would say that. I would say you, again, I don't know your history or what kind of treatment you had, but if you're 3 months out of your treatment, your body is still healing. So you want to make sure your body's getting all the nutrients, all that you can have. With respect to swallowing function long term, if you did have radiation treatment, we definitely would want you to get back to solid foods to try to kind of move your muscles in a more functional way for the solids, but understanding the pain management piece. So working with your provider, maybe, taking your pain medications prior to eating and seeing if you're able to do it that way. But the hope is the further out that you get, hopefully the pain piece will go down and you'll be able to increase back to, a more regular diet there.
Okay.
About appetite, the same with Jorge. Appetite is an issue right now. So we're working on it by I don't know. I had this idea. When I was a child, I was pretty particular about what I would eat and not eat, and presentation of food and size was really important to me. So I have started presenting food in a non-threatening manner, like in small portions. Pretty food, like pretty colors or flowers from the garden. Making sure that when I cook, the smell circulates the house. So that could be another stimulus. So there's all these other things around eating that can help with appetite. And, also marijuana is legal in California for those of us who choose to go down that route. That has helped with appetite. I'm not making a recommendation. I'm just stating, what's true. What else? Size. The size of the food. If it's in little bites, it's much more attractive, like something that you can pick up and put in your mouth and see if you like it. And of course, I have no business in saying this, but I will say it anyway. 3 months, you're still recovering, right? Give yourself a chance to heal. And, appetite, I do believe will come. Just give yourself space and time to heal, and things will happen. You don't have to feel the pressure of, oh my goodness, my appetite is not there. Okay, well, not right now, obviously. Otherwise, we wouldn't have this discussion. It's okay. Oh, and saying it's okay, I wanted to thank nurse practitioner, the first panel, Lily. When she said that, I really appreciated when you said it's normal to feel this way. It's okay. When you were talking about anxiety and things like that. So I really appreciate. I really needed to hear that. So I want to give that gift back to you. It's okay. Right now, that's where you are. That's how I see it anyway.
Thank you. And then just to add to that too, I also talk about your other senses. So you mentioned aroma, or, put on different music that you cook with, or sit outside. Well, maybe not today. Sit outside for, change the scenery. Or it sounds counterintuitive, but put a movie on, kind of put the safe distractions. I mean, make sure you're able to safely eat without choking while eating. But at the same time, sometimes we kind of take that focus off of the meal. Right now, food is medicine. And I hate to say that too, right? It is. It's not my favorite part of my job. I love when people enjoy their food. And I always tell my patients, we get to that point where they're like, I enjoy eating whatever that food was. And I'm like, okay, you probably never thought you'd say that. And, Amy has her list. And you did. You got to that point. It does. It takes a long time. And again, just to make sure, just to validate you that this is so normal to be at the 3-month mark. Your body's just doing a lot of work right now. And so it's good that you're putting in the nutrition you need the way you're able to do it.
So, okay, we just want to add one thing to that. I was just thinking, I saw a patient last week who was about 6 months out. And I just saw him and his wife. And every time we got on the call, he was like, I don't like to eat. I can't taste. Everything tastes like cardboard. I have no appetite. I'm eating because I have to. I know it's part of my medicine. And I got on the call with him, and he was smiling ear to ear. And I was like, what's going on? He's like, I could taste this. I could taste that. I went to a restaurant, and I just wanted to have like the drop the mic moment where I was like, see? Because he was just like, when is it going to? When is it going to? I'm like, your body is healing. I think we're kind of all saying the same thing. But, keep making sure that you're not losing weight and your body's continuing to heal, and you get, the nutrition, hydration, proteins, all that you need.
All right, one last question or point.
Yeah, it's not a question. I just want to add something to that about your concern about the shakes. American diet is really bad in general, right? So having this shake is probably some of the best food you've had in your life if you look at the ingredients. But I'm not talking about the boost and the Ensure because I think they're designed to be taken 1 per day or 2 per day. So they may have too much of other nutrients. But if you look at the ones designed for feeding, they're so very well balanced and they don't have a lot of sugar, which is not good for your teeth. So while you're having that kind of feeling, don't worry about nutrition because you'll be fine.